Hello, everyone. My name is Braden Johnson, and this is the Back to Barbell podcast. This is something I've been meaning to do for a while, but haven't had time to get around to it. But essentially, what I am wanting to do and accomplish with this little podcast is I want to help people who are struggling with back pain of any kind, mainly lower back pain, something I've personally been through and have struggled with it for many months to years, and I understand how debilitating it is. So I've put a lot of research into this and have worked very hard to understand what causes back pain and how we can take care of it. So just to understand a little bit about me, like I said, my name is Braden Johnson. I played college basketball. I played 2 years at a junior college and then 2 years at a Division two. And after that, I worked for a little bit and then got really into personal training and fitness. And then from there, I moved into the physical therapy realm. Right now, I am a final year. I'm in the final year of physical therapy school, so I'm a student physical therapist. Um, though I am only a student, I feel very proficient and comfortable when talking and treating about the lower back. Um, so, even though I'm not quite yet a doctorate level physical therapist, um, I've done a lot of research. I have looked at a lot of articles and I understand very well about back pain. That being said, in the future, I'd like to get other people on who are more experienced that could potentially give more of their insights to help us understand more about back pain. So today, for this first episode, I just want to go over kind of an overview of what back pain is and how we can categorize it. So my goal here is to help people really simplify what is back pain. Realistically, back pain is something so complex and it's hard to understand, and that we really can't fully understand it. And now there's still a ton of research being done about back pain. So, just to preface a little bit, I want to tell you my story about back pain. So, I played 2 years I was playing 2 years college basketball. My second year, I noticed that I was getting some pain down my hamstring, and I went to the trainers, and they believed that it was a hamstring strain. And I was naive. All I wanted to do was just play ball. So I believed them, and they treated it as such. This occurred my second year, like second week of the season. I noticed the pain, but it wasn't quite irritating enough to where I couldn't play. So I just kept playing through it. Trainers did what they thought they could and treated my hamstring. It didn't really get better, but it didn't really get worse until about my last month of the season, and then towards the last game of the season, we lost in the conference championship, and I was driving home with my family, and I noticed that the pain when I was sitting in a car, I could not relieve the pain like I usually could when driving. And I noticed getting in and out of the car was really difficult for me, like excruciating. It would light my leg up. A week later passed, and I started to notice that when I would go to sit down and then stand back up, my pain would increase significantly. So, anyways, kept doing what the trainers told me to do. I went into the trainer again, said, "This is what's going on." He referred me to just a primary care physician. He told me that he believed it was SI joint dysfunction. Went to physical therapy for that. They did not properly assess me and thought it was also SI joint. I got fed up with that. Pain kept getting worse. I couldn't stand up or sit down without pain. I started to notice my calf was going weak. I couldn't do any calf raises. I couldn't jump on my right leg. So I went to another doctor. He told me it was piriformis syndrome. It gave me a little bit of relief, but really I was still weak and I couldn't sit down or stand up, and now I couldn't sleep without there being a ton of pain. And then I went to another doctor, and he incorrectly diagnosed me. And so I was feeling a little bit lost. He believed it was could have been a spinal fracture. He sent me in to get an x-ray. That was negative. Everything checked out and looked good. So I was feeling lost. I didn't know what to do. I couldn't play basketball at this point. I couldn't sleep. Luckily, I had a relative who was a physical therapist. I went and he properly assessed me. He said, most likely this is a case of sciatica due to most likely a disc herniation. And he said, if you work with me, it's going to take some time, but you're moving really poorly. And he said that he could get me back to 100% if I just worked with him. But as naive and as impatient as I was, I took that information, went and got an MRI. I paid out of pocket for an MRI, which was close to $600 to $800. And then took that information to a neurosurgeon. Neurosurgeon looked at me, said, let's get you into surgery, got me into surgery, and I was out. The surgery did relieve a lot of nerve tension. The burning and tingling was gone, but my back pain persists. And I played 2 more years of college basketball with crazy back pain. Luckily, the nerve pain was gone. I was not struggling to I wasn't struggling with weakness or anything like that, but after every practice, before and after every game, I had to have the trainers work on me. And anyways, so that brought me to decide that I needed to take this case in my own hands because my back pain wasn't going away. I did my own research, got into personal training, started doing my own back exercises, got into strength training. I worked with a physical therapist, started doing proper mechanics, and my back pain went away instantly. I move differently now. I feel better. I've honestly never felt this good, especially my back. So that brought me into doing what I'm doing now, physical therapy, and I found a passion here with helping people solve low back problem. So a few things that I learned here that are key takeaways that everybody listening needs to take away is that there are 2 approaches to back pain as far as treatment goes. You can go in and get a MRI, X-ray, CT scan, what may have you, which may lead to surgery, or you could go the more conservative traditional route is what they would call it, and do rehab physical therapy / exercise to treat your back pain. That being said, I looked at 5 to 6 articles online through PubMed, and I'll put the articles down low. All of them say that the outcomes for surgery versus exercise / rehab are the exact same. There's no disability difference. So to preface that, whenever you are experiencing pain, usually as physical therapists or healthcare providers, we do something called an outcome measure. That's the thing that when you go in for a session with a physical therapist or go see the doctor, they give you that questionnaire that asks you a billion questions about your back. That's an outcome measure. They use that outcome measure, compared it before and after surgery and rehab, and have found that the drop in disability, so the improvement of pain, was the exact same. But there was one study that was different than the rest that said that even though pain disappeared, pain came back 20 to 40% more in people that underwent surgery compared to exercise, which was only 10% had a return in symptoms. So there's something important to look at here. When I went in for my back surgery, all the doctor did was remove the disc herniation that was impinging on my sciatic nerve. That was all he did, and that's why I still had back pain. when you go in for surgery, they're not going in to fix any underlying causes or conditions in which gave you the back pain. All they're doing is just getting rid of your symptoms. That being said, when that's the mentality, there's a good likelihood that you may go into surgery and that doesn't even relieve your symptoms. And you could still have the same symptoms after your surgery that you went in with. So that's an important thing to consider. And then after your surgery, even though your symptoms are gone, the recurrence of you having back pain is 20 to 40%, which honestly is pretty high, especially if that's a pain that's been so debilitating it required surgery. And in my eyes, that's not a risk that really is worth taking. Whereas when you are properly diagnosed and screened, and people properly look at your movement patterns, they can properly find impairments that lead to, for my case, a disc herniation. For example, I'm 6'6", and I have a very long torso compared to my limbs. That is a great example to why I had a disc herniation and led to poor movement mechanics. So by going to physical therapy, doing rehab exercises, etc., they can find poor movement qualities or impairments that need to be fixed or adjusted to help you move pain-free, if that makes sense. So basically, what is actually causing your pain is being addressed, whereas through surgery, you're just getting a relief in symptoms. Overall, that's just going to give you longer term relief. So as we move on, that's something to consider, that when considering between rehab versus surgery, though rehab may take, well, for sure will take a little bit longer, you're not only fixing and lowering your pain, but you're also bettering your movement quality. You are bettering your posture. You're moving more efficiently, and overall it's going to affect you better in the long run. So, just remember this. You will never overcome your back pain until you realize that pain will persist through your life until you relearn how to move. So relearning how to move is the key to overcoming back pain. Whether that's before you decide to do surgery or even after you've done surgery and you still don't feel 100%. You need to relearn how to move. That being said, movement's not the only thing that can contribute to back pain. I've said it to many people, and they preach it in school now, that back pain is multifactorial, meaning there's many things that can contribute to back pain, not just X, Y, or Z. So when I look at somebody who has had chronic back pain for 2 years, I want to know, how are they sleeping? Where are their stress levels at? How's their activity level? Are they moving throughout the day? Are they getting their quality exercise? How's their diet and nutrition? Is that are they giving their body the proper amount of nutrients to heal? And then do they have any past trauma that they may be holding on to? Something interesting, but that's a whole other podcast that I'll get into another day, a whole other episode. But that it's something to consider. So if you are somebody who has poor sleep, has a lot of stressors in their life, doesn't work out very often, considers that you have a poor diet, or if you have some sort of past trauma, that's something to look into and see if you can resolve. That's something we'll get back to in a little bit, but something to consider. Overall, those things, what they end up doing is, if you hold on to them, they can decrease your pain threshold. So when I say that, what I mean is your body's perceiving pain at a lower rate than it would a normal person. So what would something that would be like, if I were to bump my hip into the wall, might not hurt for me, but somebody who's experiencing trauma, has high stress, is sleeping poorly, etc., they may hit their hip in the wall and they may think that they just broke their hip because they're in so much pain. So a difference in pain perception. And that's a whole other topic to get into about pain and how pain works. But what I want to do more this episode is talk about movement patterns. So after I take a thorough history, I want to see how someone's moving. And you can learn a lot from somebody and why they're having pain by just watching someone move, watching them walk. I really like watching how people squat. I think really contributes to somebody's having pain. After I look at somebody move, I can usually figure out what type of impairment they have and how I need to treat it. And what I'll do is I'll place their movement patterns into 4 subgroups. And these groups focus on a main impairment that they have that they need to fix. And if they change that impairment, most likely, well, not most likely, they will be pain-free. And those 4 topics are a mobility deficit, so stiffness. This is common with acute injuries. So if you say tweak my back or you're trying to deadlift, that and you hurt your back, that's usually what a mobility deficit is. Movement coordination issue. This is when your spine is moving all over the place and it feels like it's hard to keep your spine upright. And for example, if you go to pick something up, it feels like it's really hard to stand back up. Radiating pain, that's sciatica. Usually that has to do with a directional preference. So if moving one way feels better than moving another way, that's one category. And then the 4th category that I usually sometimes put people in, and which is honestly, I think could be the most complicated, and it's really patient dependent on how they rehab from it, it's just general back pain, which sounds kind of lazy, but this is usually caused by either weakness or, like we mentioned earlier, a decreased pain threshold. So usually they're holding on to trauma, poor sleep, etc. We've already discussed that. So if I can put somebody into one of those 4 categories, I can confidently help that person, and I know that rehab and exercise will get them back to 100%. And usually that's the case. Very rarely can you put somebody in that category. There are moments when somebody may need to get screened or go in and they actually have some sort of pathology occurring in the spinal cord or in the vertebrae. Not super common, but can happen. And we'll talk about that in future episodes about how to know if that is the case for you. But as for now, don't worry too much about that, because odds are that may not be the case. So let's talk about what a mobility deficit entails and how you know if you have a mobility deficit. First off, pretty much the hallmark sign is that if you try to get out of your midline or your normal posture when standing or sitting, if you try to bend out of it or reach out of that posture and that movement aggravates pain, you have a mobility deficit problem. It's really common to have a mobility deficit problem after you've had an injury. For example, I was playing basketball the other day, went up to get a rebound, and I landed weird, and I felt a spasm in my low back. Not a super big deal. In 2 or 3 days, I was fine, able to come back from it. But usually that's a mobility deficit. I feel stiff, I feel guarded, I feel like I can't move outside of my little cylinder. I feel like I can't bend over to pick something up. However, there are cases where this is a chronic issue. This is commonly caused by muscle guarding. So either you have most likely it's a weak set of spinal erectors or any muscle that's connected to the spine. They're weak, and to compensate for the weakness, they will tighten up and try to make the shortening of the muscle work instead of just normal strength or tone of a muscle. So our goal is to strengthen that, bring back the tone, or it could be caused of just spinal stiffness. You don't move very often and you stiffen up, you sit in a chair all day and you think you have normal posture, but all you're doing is just putting pressure and stiffness into that spine. So what we want to do is move the spine and try to loosen up the joints, because realistically when you look at a spine, all it is just joints stacked on top of each other. Usually this can be caused because of also poor hip control or strength. So if you have weak glutes, weak hip flexors, weak abductors, etc., this can also cause stiffening in the low back, because if you don't have the support from your hips, there needs to be compensation somewhere that gives you support, and so your low back will do the work and stiffen up for you. I did say if it's an acute injury, usually I recommend just doing 2 or 3 days. It's not going to be fun, but 2 or 3 days of active recovery, which is just walking, a lot of walking, light stretching, maybe some biking. Usually that'll help reduce symptoms, and then 2 to 3 days, it will be fine. But if you're past that 2 to 3 days phase and it still feels the same from when you injured it, then we have to start working on movement patterns and seeing how your hip looks, see if we can strengthen your hip and loosen the spinal muscles and loosen the spine altogether. The next category is movement coordination, which is really common among people with chronic back pain. Really common among just Americans in general, especially if you have a traditional 9-to-5 where you're sitting in a chair all day. Usually this is caused from weak, pretty much the opposite of the last one, but this is due to weak spinal stabilizers and stiffness in the hips. It's also really common to confuse this with sciatica, because traditionally sciatica goes below the knee, and if it's not going below the knee, most likely you have a movement coordination issue. Movement coordination tends to manifest itself sometimes through referred pain, and you'll feel that almost like it's tightness and discomfort in the butt or hamstring. Not to say there may not be a nerve being impinged, but by definition, if there is not pain going below the knee, then it is not considered sciatica. And that would be considered a movement coordination problem. So this is something that I had that led to my sciatica and led to my surgery, was I had a movement coordination issue. Side note real quick, this can be paired with sciatica. So if you have sciatica and you have pain radiating below the calf, I would assume too that there could be a correlation between movement coordination and sciatica. So I wouldn't just treat your sciatica, I'd also treat your poor back stabilizers. Okay, so back to my case. I had a hypermobile spine. I said earlier that I had a really long torso, and my back did a lot of the work for me. And my hips, I guess I didn't realize that at the time, but my hips didn't move a lot. I had really poor hamstring flexibility. I had really poor hip flexibility. And so to compensate, I got the movement. To compensate for my lack of movement in the hips, I got the movement in my low back. So that caused loosening of the spinal stabilizers and caused a hypermobility in my low back. The key here is what we want to focus on is lumbopelvic rhythm. This is another thing we'll talk about in a future episode. But lumbopelvic rhythm is the ratio between your hips and your back moving when going to flexion and extension. So when you go to flexion, your hips need to do, in full movement, your hips need to do 70 degrees of flexion, where your back only needs to do 40% or 40 degrees of flexion. So if your back is doing more than 40 degrees and you've got more of a 60 degrees of spinal flexion, your hips won't be moving as much. Or if your hips are getting less than 70 degrees, then your back is going to have to add to that lumbopelvic rhythm. So we need to correct that. And that's usually done by doing a lot of hip hinges. So if you need to work on that rhythm, I love working hip hinges. That will be a huge focus when working with me. Because hip hinging does so many things. It focuses on that lumbopelvic rhythm. It works on back stabilization. It works on hip mobility and hip stabilization. And overall, it just kind of teaches that neuromuscular connection between your muscles and your brain of how to move properly. Usually I start doing light isometric holds. So we'll do a hip hinge and we'll just, as long as it's pain-free, we'll stay there for 30 seconds to a minute. And then I'll progress that to eccentric hip hinges and then concentric hip hinges and start loading weight as we go. And there's a lot of other things we can do. Floor exercises are fantastic for this specific condition as well. Now, a really common one we'll move on is with radiating pain, which is sciatica. Sciatica, it's kind of complicated. It's kind of the go-to if you feel any pain in the leg. I have sciatica. But like I said earlier, it's not considered sciatica unless it gets into that calf. That being said, whenever there is pain in the leg, and this we can refer back to the last category, but whenever there is pain in the leg, I focus on the patient's movement preference and direction preference. So, for example, when I bent over, when I had really bad sciatica, it would light me up. Like I would feel burning down the leg. I would feel numbness, tingling, and just a ton of pain. That's why when I got in and out of cars, I would flex my spine and that would cause pain. When I also look at this, I want to check and see if they have a mobility and movement deficit and movement coordination deficit paired with it. Usually it's not uncommon to see that they have both conditions paired with sciatica, or one of these conditions paired with sciatica. So I'll assess that, but usually the patient's number one goal is let's get rid of the leg pain. So I'll say, okay, let's treat the symptom first. So what we'll do is we'll focus on treating the direction of the pain. So that being said, our goal is to centralize the pain in the leg and bring it closer to the back. So if we do a movement and they feel pain in the calf, we want to get it up to their hamstring, up to their butt, and then into the back. If we can get the pain in the back, then that's where we can really start to work on movement quality. The biggest type of treatment, what we would do is if they can't flex, we're going to work on extension, which almost seems counterintuitive because in physical therapy and in other type of rehab interventions, you want to kind of work on the deficit, where here you're kind of going the opposite way of the deficit. So there's a few research studies done that show that if you work on increasing range of motion one way, it'll improve range of motion going the opposite direction as well. So if we keep working on that back extension and we do a lot of those prone press ups and we do a lot of other things like that, research shows that we should gain control and range of motion back into flexion, which takes time, but it can be done. And when paired with other exercises, we can accelerate that and make that more efficient. So yeah, I mean, that's the big takeaway there. But it also, with sciatica, requires a very thorough assessment. Like, I'm not going to go in and just see, oh, okay, they prefer extension. We're only doing extension exercises. I'm going to test their spinal stabilizers. I want to test their glutes. I want to test their adductors. I want to test their hamstring strength. I want to test their hamstring length. I want to test a lot of other things and see if there's any other movement patterns that are contributing to the sciatica pain. Also, with extension exercises, the theory also holds that when we go into repetitive extension exercises, if there's a disc herniation, we're reducing that herniation back into the disc. So something to also think about while you're being prescribed these exercises. The last one, and I'm going to do a whole other episode about this category because of how complex it can get, is generalized pain. This is so complicated because there is no impairment pattern that follows an anatomical pattern. Unless they have weak spinal stabilizers or weak glutes or something that's paired with it, it's really hard finding the impairment that goes along with their pain. That's why when I have somebody come in and I can't match their symptoms with the other three categories, I'm thinking generalized pain. So the biggest thing here is taking a very thorough history, trying to see if the patient has any problems with sleeping, if they have poor diet, if they have any stressors in their life, or I want to check their activity level. If we can find something, usually if they're sleeping poorly, if we can get their sleep to, if they're sleeping 3 to 4 hours a night, if we can get them to 6 to 7 hours a night, usually there's a reduction in symptoms. It may not completely solve the issue, but it would put us on the right track. Same thing goes with diet. Diet is very critical when it comes to recovery and rehab. A big push that I believe in, and that kind of the medical community is doing, is pushing the Mediterranean diet. From personal experience, I really like that diet. I don't even like calling it a diet because it's more of a nutrition guideline rather than a diet, which I guess you could define as a diet anyways, but that's beside the point. It is a anti-inflammatory focused diet, but it's not very restrictive. You can eat as much as you want, you can eat as little as you want, but it basically gets rid of the inflammatory causing agents like high amounts of sugar, excessive amounts of dairy, etc., that cause inflammatory triggers to go off in your body. So something to look into if you're not doing that. The other thing along with that is I like recommending high dosages of protein, especially because it's so good for muscle health. I recommend 0.8 to 1 gram of protein per body weight. So I weigh 220, and I try to get at least 220 grams of protein a day in my diet. And sometimes people hear that and they think, oh, that's so hard. But when you're planning out your meals each day, it's not that difficult to be done. That's something we'll address in the future episode. But yeah, look at your diet and see if there's something there. On top of that, water, 2 liters of water minimum a day is really important. And then stressors. If somebody has a stressful schedule, or they are they have somebody in their life who's causing them a lot of stress. Usually I'll sit down with them and say, okay, how can we adjust this so you are not only worried about this in your life? Because when we have something that is so consuming in our life that takes up 90% of our thoughts and causes our sympathetic nervous system to rise, and increases our amount of cortisol and other things, it'll decrease the other side of things, which helps lower our pain and helps calm us down. That's why sometimes when we bump our hip, and it wasn't that hard, but we're really stressed about a test or work or a family member or whatever, sometimes we'll bump our hip or bump our toe. And what usually seems to be a very just annoyance, like just something that's annoying, would turn into almost like I need to take 10 minutes and sit down because I'm in so much pain. So yeah, if you can figure out and identify what stresses are giving you problem in your life and cut those out, or find a way to approach them differently to reduce that stress, I would be very significant to help lower your pain. And then the next thing I would look at is activity level. Oddly enough, this is really common with former athletes, especially like those who played at a high level. And once they're done, they stop working out because they were so used to a life of working out. And then when they stop abruptly and they no longer have that consistent workout routine, usually it manifests itself through back pain. And it's pretty crazy. Some people that I've worked with, once they just get on a simple strength training schedule or they get on an aerobic exercise schedule, their back pain will just disappear and they won't have it. So if somebody comes into me, regardless of the population, if they say they're not working out, I will prescribe at minimum a walking program to get them getting 10,000 steps a day. Or if they are walking but they're not working out consistently, I will write up a 3 to 4 day strength training program or aerobic program, whatever they prefer. Honestly, they just need to get moving. And that's actually the highest supported evidence for any of these categories, is by just exercising, you can reduce symptoms significantly. And then with this population, the biggest thing is just to educate, just to be educated. So if you are unsure what category you fit in, and if you don't fit in these categories, just researching pain, like what is pain? Why do I have pain? And going to a medical provider and having them explain what pain is, that can lower symptoms significantly, which is very interesting. But it's like a psychological component to pain. And it shows how closely linked the brain and the body is, and how much power we have when we learn to control our brain and what we think and how we understand life. So yeah, there's a lot to get into in that category, but I'll hit on that when we go on to another episode. So that's all I wanted to hit today. A lot to go over. Just to quickly summarize kind of what I talked about. It's important to remember back pain is super common. Like if you have back pain and you're struggling with back pain, you are not the only one. 80 to 85% of people in the world will experience back pain at least once in their life. So don't think that because you have back pain, you're hung to dry and you're by yourself and you have to figure it out on your own. There's so many resources you can go to. I hope to be one of them. And it, and it really, it doesn't need to be that complicated, even though it may look to be. So when it comes to looking for symptom relief and other kind of things, learn to understand how you're moving, Pay attention to what causes pain, what doesn't cause pain, and what alleviates pain. And that can put you on the right direction of how you need to approach your treatment and your therapy. When it comes to deciding whether to get surgery or try to go for surgery or try to go to rehab, ultimately it's up to you. I think both roads need to lead to correction of movement. The most important thing out of this whole thing that you can get out, if you've learned anything, is you will not overcome back pain until you realize that pain will persist through your life until you change the way you move. So movement is key. So outcomes through surgery, as far as pain relief goes, outcomes will be the exact same. One will lead you to more efficient way of moving and reduction of symptoms down the road. Surgery, 20 to 40% of people that undergo surgery will have a return in symptoms. So, obviously my recommendation, the field I'm going to, I say go to rehab, but I decided to do the surgery route because I was impatient. I didn't know better. I did the surgery route. It gave me relief of symptoms. I still had residual symptoms, and it wasn't until I moved 3 years down the road until I changed my movement pattern is when I found a reduction of symptoms. And then as far as the 4 categories go, we reviewed it. You can go back and listen to it. That would be mobility deficits, stiffness in the back, movement coordination issues, you're feeling hypermobile, you're bending a lot, radiating pain, which is our sciatica pain, and then generalized pain, which is that tricky one that is more of a psychological and unexplained cause of pain, but can still be resolved. And we have valid research to back it up and research that can be treated. I appreciate all of you for listening to this. If you have any questions or you want me to talk about something specific, feel free to reach out to me. Again, my goal is to not make back pain complicated. I want to simplify it as best as I can and be that research and that support for people that need it. That being said, if you're struggling with pain and you just don't know where to start, I would love to help you out. So head over to my Instagram. I'm just starting a business to focus on low back pain and to help people struggling with back pain. DM me, go to my links, and I'd love to discuss about how we can get you started of getting rid of your back pain. Thank you so much for listening. This is my Back to Barbell podcast. I hope to see you again next time. Have a good day.